Vaccine rollout begins to be a reality across North America. The pace of the COVID-19 pandemic continues to be, as we keep hearing, of major concern. There will be more deaths before a vaccine is widely available. One place where vaccines won't be particularly deployed is in schools. They are not to be administered to those under the age of 16. Schools, of course, also a place where policymakers the world over have been pretty determined that they should remain open. Is there a contradiction there in controlling the pandemic with a group of young people who may well spread it after the vaccine has been deployed? Emily Oster is with us now. She's a professor of economics at Brown University. Thank you very much for being with us, Emily. And I actually want to just start by backing up and saying the kind of importance of the schools. I think we all understood it. It was underscored in March. You can't have a healthily functioning labor force if the kids aren't cared for somehow. So forget the fact that we want them to learn to read and write. They need to go somewhere every day or we can't do our jobs. Is that enough to be driving this sort of policy of keep the schools open no matter what?
I think that alone is certainly worth something. I think part of the reason this has become so urgent in the last couple of months is that we have started to realize that not only are those concerns very salient, but the losses, both learning losses and socio-emotional losses to kids, are enormous. So I think even relative to what people expected, the downsides for kids have been so great that the push is now coming from a lot of different sides, even more than it was in April or in September, frankly.
So, I mean, to this question of, we won't see vaccines deployed in the under 16 group, does that create, do you think, a gap that will be problematic as we move forward?
I actually don't think so. I mean, of course, it would be better if they were vaccinated. But I think that what we're seeing in schools is, in general, they're fairly low risk. But to the extent that there are, people who are more at risk in schools, they are older staff members or maybe high school students. So if we sort of say, OK, actually, the vaccine is going to be approved for staff, and maybe even in the U.S., there's some talk of getting educators in an early wave of vaccines, that will make schools much safer. Kids eventually will get vaccinated, but I think they are not the high risk group. And if everyone around is vaccinated, I think that can make us much more confident in school opens.
We have this kind of strange crossover period where the case numbers will rise, deaths will rise, the risk remains high, and yet we have optimism around vaccines. Health authorities have kind of identified that as a sort of a dangerous place. When we think of sort of the economic consequences of COVID, how do we measure it as we sort of cross over from one to the other?
Yeah, I think it's hard. And I think part of what I think many of us are finding frustrating is we sort of, like, now that we have a vaccine, it seems like we're saying, OK, great, it's all over. And I think there actually is still a lot of space for many of the other kinds of interventions that we would have been using in the absence of vaccine. So I would still like to see more testing, more routine testing, more frequent testing as a way to kind of reopen the economy in this period, which, let's face it, is another 6 or 7 months before we really get sufficient vaccine coverage to be confident in reopening for that reason.
So, as you may know, one place Canada does not shine in this pandemic has been on testing. We don't particularly have access to rapid tests. We aren't deploying testing or tracing very well across any part of our network. So we certainly aren't testing in schools. In your research and your experience, if we were testing in schools, what would we be likely to find?
I think what you'd be likely to find, based on what we're seeing in asymptomatic testing in the U.S., is you'd be likely to find fairly low rates. So the positivity rate among people kind of tested asymptomatically in schools here is far, far lower than the positivity rate, say, in the community at large. It's not quite an apples to apples comparison. But just in general, when we do that kind of surveillance testing, we are finding fairly low rates. But we are finding some people, and there are some asymptomatic people, actually, particularly staff. And so there is some value to that testing because it pulls people out of that pool before they can infect others. So I think several states, Colorado is notable, have actually done some very effective routine teacher testing. I would like to see more of that happen in the U.S. and maybe also in Canada over these next kind of 3 or 4 months before we start having more vaccination levels.
Yeah, which is, I guess, an interesting area as well, is will we kind of relax our guard on the learning we could do here because we see, so-called light at the end of the tunnel? How much policy pressure will there be to say, no, we actually have to keep knowing what we don't know about this particular virus and this pandemic, perhaps if only to prepare for the next one?
Yeah, I mean, I think that exactly you put the nail on it. That I think there's a sort of view of like, okay, complacency, we fixed it, we have the solution, let's just wait for the solution. But I think we do need to keep our eye on how are we going to address this in the absence of the vaccine, both because we have some time and this time is going to be important for schools and for the economy in general, but also because we may get another pandemic, and I kind of hope we'll be managing it better than we managed this one.
I do want to ask you, how you think education is working in all of this. It's something that we've been asking a fair amount. There's been a little bit of data that we've seen on this side of the border, but especially that post-secondary level where it's so important that, this is a level where, not that it's not all important, but that higher level of learning, you don't want people to fall behind because it's their one shot at it, really. What do you think is happening with this whole group of young people?
So I think we are losing a huge amount. I think we're losing in a bunch of different dimensions. So for younger kids, I think we are losing because it is very difficult in kindergarten to learn to read on Zoom. It's difficult for kids to focus. Asking a 6-year-old to be on Zoom for 8 hours a day, that's not really feasible for them. We are losing because some kids, particularly poor kids, kids of color, are literally not on Zoom at all. So they don't have reliable internet access. They're not able to get access to school. And then at these higher levels, when kids should be kind of together and really sort of diving into the things that they need to learn, that kind of like real skills to go to the next level, I think we're going to start seeing more dropping out. We're going to see kids who literally leave school. So it's kind of, some people have said, oh, they'll make up the extra year. But there are a bunch of kids who are just going to leave, and they're never getting that extra year. They're never getting any more years. And I'm not really sure how we're going to fix that, but it is clearly with us.
And I guess the other measure that we hear that feels a bit dire is if you are set back in your first job, in other words, if the salary you take in your first job is lower than your potential, it's actually a permanent setback. That first step is a really important one, economics says. How do we deal with that? Or how should we, I guess, start thinking about the consequences of that?
Yeah, I mean, it's an interesting question because, as you say, there's a fair amount of literature that sort of students who graduate in recessions tend to do worse later. And, it's not clear how to ameliorate those problems or any of these problems other than to, make sure that we are kind of aware of them and highlighting the opportunities that maybe, there may be really excellent people to hire who kind of got a slow start because of the pandemic.
It is great to have you with us, Professor. Appreciate your time today. Emily Oster is a professor of economics at Brown University.